Every year, people ask Medicare Advantage or Supplement, but in 2026, the answer isn't as simple. Here's why. Welcome back to Medicare Happy Hour, the most fun you'll have on the internet while talking about Medicare. Today, I am enjoying a vodka berry limeade, and it's pretty tasty. So cheers. All right, so first things first, before we talk about, pros and cons of each option and, what's changing for next year, let's start with the basics. So first things first, Medicare Advantage is generally little to no low premium, but they are network based. So you have to see HMO means you have to see a network doctors. PPO means you can go in and out of network. They include some dental, vision, hearing, and those extra benefits. And these are generally based off of copays. So you have a copay for everything you do throughout the year. Supplements, on the other hand, these are generally a higher monthly premium. They're fairly significant. There are no networks. Anyone that accepts Medicare accepts a supplement. So there's less kind of out of pocket. You have little costs throughout the year aside from your monthly premium. This does not include your Part D drug plan like the Advantage plan or any extras, things like the dental, vision, and hearing that I just mentioned. And these are lettered A through N. So if you hear, friends or others talking about the G plan, the N plan, things like that, they're on a Medicare supplement. So, some changes I want to mention that are occurring for 2026, and these are not 100% finalized, but everything that we've read and sort of the Medicare Trust Fund, everything has alluded to this. So we feel pretty confident these are what the numbers will look like. The Part B premium is increasing to around $206.50. Now, as a reminder, if your Part B premium increases, your Social Security cost of living will also increase. So you'll see more in your Social Security check, but you'll also be spending more on your Part B. The Part D deductible for next year, and different plans handle this in different ways. Some of them waive this, some of this waive part of this, some of them you would pay the whole thing. It is $615. And last, the Part B deductible for 2026 is $288. Now, that doesn't necessarily apply to anyone on the Medicare Advantage plan, but it would apply to anyone on a supplement. You still have to pay that small deductible. So let's take a look at, frankly, at the end of the day, the questions we always get from our clients every fall, but also just all the time is, well, what should I do? Should I go on an Advantage plan or should I go on a supplement? And I am not here to tell you there is a right answer for you. It really depends on your specific situation. And I'll go over the pros and cons of these plans in just a minute. But when we talk about next year and some of the things that are happening, Part D, the out-of-pocket costs for 2026, you may remember, and we have videos on it, but in 2025, it was the first time that Medicare capped your out-of-pocket costs for Part D drugs, and they capped it at $2,000. In 2026, that will be $2,100 that they're increasing the Part D out-of-pocket max to. It really helps a lot of people because a lot of people spend thousands and thousands and thousands of dollars on their Part D costs. So again, that is capped and it's $2,100 for next year. Most Medigap plans, most of them have their out-of-pocket covered. Most of these I mentioned earlier that most plans that you're not going to have a lot of copays or things throughout the year. But plans K and L do have a maximum out-of-pocket, so be aware of that if you're on one of those. Medicare Advantage plans, some of the maximum out-of-pocket amounts, again, those MOOPs as some call it, they are adjusting. Some are increasing, some are decreasing. Plan availability. There are some Medicare Advantage plan exits. And I'm going to talk about this again in a minute, but we're seeing some of the insurance companies pull out of some rural areas or stop offering certain plans. This has been more of a tumultuous year for some of the insurance companies when it comes to the Medicare Advantage plans. I think it's already starting to stabilize, so it's not something you need to be worried about, but it is just something that's occurring. And last, some Medicare Advantage plan benefits are changing. It really just depends on the plan. We've seen these plans get so rich over the last 5 years, and frankly, they probably weren't sustainable in the route that they were going, but I think that the plans are still going to be very strong options. So let's go ahead and talk about the pros and cons of supplements versus Medicare Advantage plans. All right, so this is probably the Medicare question that I get the absolute most when it comes to people finding out that I work in this industry is, ooh, Medicare Supplement or Medicare Advantage? And frankly, getting this question that often makes you want to drink, so cheers. All right, so we're going to go through the pros and cons of Advantage plans and then supplements, and then we'll do kind of the way I like for you, the way I just recommend you to think about these plans. So Advantage plans. Pro, as I mentioned earlier, these are generally a lower monthly premium, so little to no. There's a lot of zero premium plans available, etc. They're all in one convenience. You get all of your health insurance and your prescription plan. They're all tied into one, including, like I said earlier, the extra perks, the dental, vision, hearing, some of those coverage as well. Some of these include gym memberships, things like that. They do have a maximum out-of-pocket limit. So you know going into the year essentially what your worst case scenario would be. If you're in the hospital for, I don't know, 300 of the 365 days, you still know what that limit is going to look like. And the care coordination, just knowing it's one plan, one card, etc. Cons, these plans do have networks. There are, I mentioned earlier, the HMO where you have to go see in-network doctors and the PPO where you can go in and out of network, but if you're going in-network, you're going to pay less. So the network restrictions it's generally something we really recommend you take a look at. It's what drives a lot of our recommendation as to which plan we're going to show certain individuals. Referrals may be required when it comes to Medicare Advantage plans. The cost sharing can add up. If you're going to the doctor constantly and you're paying maybe $0 to go to a primary care doc, but $40 to go see a specialist, and you have to see several specialists, that can add up over time. Same with, as an example, physical therapy. If you're going to pay $25 to $40 a visit to get to see a physical therapist, that could add up. But again, your maximum out-of-pocket limit. The travel limitations. This is something important we really recommend our clients to keep in mind. If you plan to spend your winters in another area where you have regular appointments that you need to see a doctor down there, you really need to make sure that if you're on a Medicare Advantage plan, you're either on a PPO where you can go in and out of network, or there are in-network providers where you plan to spend other time. Now, the good news is if it's an emergency situation, it's always considered in-network. So, if you're just traveling for a week or two and have an emergency, you don't need to worry about that. And then the plans can change yearly. We're seeing a lot of change for 1/1 of 26, more than what we've seen in years. So let's switch gears now to Medicare supplements. So these are also known as Medigap plans. Like I said earlier, they're lettered A through N. So the pro is the nationwide access. A lot of folks like that they don't have to worry about a network. They can go see any doctor that accepts Medicare anywhere at any point. It's predictable coverage. It does not change throughout the year. The only thing that really changes is your premium can increase every year, just like your homeowners or your auto insurance or anything like that. And then that you pay that Part B premium. Those are pretty much the only thing, the Part B, well, you have to pay your Part B premium, but I meant the Part B deductible is generally one of the things that would impact you. Stable benefits, that's not going to change. It's kind of like the predictable coverage. The peace of mind, just a lot of people would rather spend more each month and not have to worry about it, but it truly depends on your specific needs and your healthcare situation. It does pair well with Part D, so whereas on the Advantage plans, you have it all together, with the Medigap or the Medicare Supplement plans, you purchase two separate plans. So you do still have to purchase that Part D drug plan, but it fits right in there. The cons are the higher monthly premiums. You could easily be spending it well in excess of $200 a month on just your supplement premium. There are no extra perks in these plans. You're spending more on them, but they do not include things like dental, vision, and hearing. As I just said, you have to purchase that separate Part D drug plan, and the premiums can increase as you age. So, the easiest way I like to describe the difference between these two plans is Medicare Advantage plan. You're showing your Medicare Advantage card when you go to the doctor. You're paying very little for your premium, generally $0. But then anytime you go to the doctor or do anything, you're going to pay a copay for that. Whereas the supplement, you're essentially paying in case you use it. So you're paying a higher monthly premium, but then little when you do anything. So it's sort of, do you want to pay when you use your care, or do you want to pay in case you use your care? There's different people, their budget, they'd rather know set what they're going to spend each month, and other people would rather keep the money in their bank and just use it when they need it. So it ultimately really depends on your situation. We see a lot of snowbirds, travelers, and people who are at the doctor with some major health issues. A lot of times we see those folks on supplements, and a lot of times some that would rather kind of keep their money in the bank. They're generally healthy. They don't have to use a lot of healthcare. They're on the Advantage plan. But at the end of the day, the most important thing is your specific healthcare situation. I'll be frank, we have people that, if they're a couple, maybe one's on a supplement and one's on an Advantage plan because they have different health needs. So at the end of the day, I really recommend you to take a look at what's important to you and what's going on in your healthcare situation. And at any point, give us a call if you have questions. We're always happy to help.